Thank you. I yield back.
Ms. Hayes, you're recognized for 5 minutes.
Thank you. And thank you, Mr. Secretary, for being here. I want to talk to you a little bit about social determinants of health, which, as you know, are conditions where the environment that people are born in, live in, work in, learn, play, worship, affect their healthcare outcomes. As of January 1st, 2024, the Center for Medicare and Medicaid Services began requiring healthcare organizations to screen for the 5 risk factors, which they determined to be food insecurity, interpersonal safety, housing insecurity, transportation, and utilities. I know that the department has done work in this area, but my concern is states are really unclear as to what this can look like. In California and West Virginia, they've done some of these things, but there really is no clear, I hesitate to use the word roadmap because I know that the department has a roadmap, but it is not clear guidance. And the thing I want to ask you about today is that under the ACA, 85% of premium dollars are directed towards patient care, and then the other 15% are the medical loss ratio formula. The things I just talked about, those social determinants of health, are not included under the patient care section. Can you speak a little bit to how we can change that and start to look at some of those determinants as part of the entire healthcare spectrum?
Absolutely, and thank you for the interest in addressing social determinants of health. By statute, we are either constrained or permitted to do a certain number of things. Social determinants of health, if you look through most statutes, are not included in the provisions of most statutes. So what we're doing is trying to elevate the issue of what can cause bad health or bad health outcomes, which, as you just mentioned, includes social determinants of health. So we are making every effort we can to make sure that anyone who's out there doing healthcare recognizes that if you're not addressing these social determinants of health, you're missing the boat in trying to keep people healthy.
Thank you. I appreciate that. I introduced legislation called the Social Determinants for Moms Act, which really talks about how all of these things as they relate to maternal health. And my legislation was included as part of the Black Maternal Health Momnibus. It asks for the creation of a task force to better address these things in this country. Do you think that the creation of a task force to at least collect data on these things would be a step in the right direction?
Absolutely, although we need to do more because we need to be able to change statutes or regulations to include social determinants of health.
Switching gears here a little bit, I want to talk about the final rule that was issued recently by the Department of Health and Human Services. Can a doctor be investigated criminally or administratively for providing care to me for cancer?
Can you repeat the question?
Is it, let me see how I want to ask this question. I'm trying to get somewhere. Can I be discriminated against for providing care if I had cancer?
For not providing you care?
Yes.
Again, you have to put it in context. Is the person working in a place that holds itself out as providing
as
cancer
a woman
care?
If I guess I'm trying to get to the point, if I had cancer, if I had heart disease, if I had a mental health condition, if I had osteoporosis, would a doctor be investigated for providing care? Would I be investigated for seeking care? Would I be investigated for obtaining care?
I think I hear if they're receiving reimbursement from the federal government, then they would have to offer you the care.
So if I
unless they have a religious objection.
If I sought abortion care, would I have the right to have that care, or a doctor deny me that care?
You would have the right to have that care if they're seeking reimbursement by a federal department, Medicare or Medicaid, if it's required by law.
Thank you. If it's required by law, thank you. In my last few seconds, I do want to bring up something that I've heard talked about on the other side a lot about the care of unaccompanied minors at the border. I want to remind my colleagues that in the last administration, we had a crisis of understaffing, of children being lost, of us not really knowing, and I want to commend the department for some of the work that they've done to improve these programs. 24/7 caseworkers, increased shelter networks, increased post-release services. My time is running out, but I want to say that unlike the child welfare system, you don't have the ability to monitor children after they leave your custody, even if they are with a vetted sponsor.
That's correct.
So I guess you could follow up and say, what are some legislative fixes that Congress could make to make sure that our connection to these children goes beyond the point where they are turned over to family members or loved ones, so that we can make sure that they are in fact safe and not falling victim to unsavory actors or trafficking or some of the other things that have been brought up in this committee hearing today.
We'll
you so
invite
much.
the Secretary to put those suggestions in writing. Ms.